Today, I will be talking about my findings on the most powerful superheroes in the world and their fight against the world's greatest enemy. This fight will be known in the history books as Garlic and the Onion Family versus Cancer, the power of a pungent posse. Who are these group of superheroes and where did they come from? They go by many names, but the government calls them aliens. It comes from the Greek word alio, which means to avoid and refers to the pungent odor of the vegetables that are part of the family. The world has turned a blind eye to this family for many years because of their pungent odor and choose to consume those with sweet and sticky properties. But what they didn't know is that this family might be stinky, but they always pack a punch. These vegetables include chives, leeks, garlic, shallots, onions, spring onions, and many more. The leader of this team is garlic. The pungent posse of vegetables, most importantly garlic, contains properties that can aid in fighting against diseases and maybe even cure the deadliest diseases of them all, cancer. Each of our members of this unique group of superheroes have their own powers and abilities. Onions contain vitamin C, manganese, vitamin B6, and vitamin K. Chives and scallions contain vitamin K, vitamin C, beta-carotene, and folate. Due to their familiarity, almost all the alliums have some of the same powers. Alliums can help protect against symptoms of diabetes, inhibit platelet aggregation, and prevent inflammatory processes associated with asthma. The leader, garlic, however, has some abilities that stand out past the rest. Garlic, also known as allium sativum, is an important member of the onion family that contains some of the same general nutrients, but has special components that can help with many diseases. Garlic has been shown to lower total cholesterol and LDL cholesterol by inhibiting the enzymes involved in cholesterol and fatty acid synthesis. Most importantly, garlic has antiviral, antiprotozoal, antibacterial, anti-inflammatory, antifungal, and antioxidant activities. One of the most distinctive attributes is its components that can aid in its fight against cancer. Cancer is one of the most deadliest diseases. The world's most wanted is breast cancer, lung cancer, and prostate cancer. In response to this disease, we have created therapies to fight against and sometimes maybe cure cancers, but as a result, many suffer from disorders and side effects. Research in food science is centered around finding potential cures for cancers without the side effects and disorders that come along with those therapies. Cancer cells are primarily associated with apoptosis, death of cells that contribute to growth and development, autophagy, consumption of body's own tissue, and necrosis, death of most cells in an organ and tissue. Our only hope to defeat cancer is the pungent posse. Garlic is a phytochemical that regulates autophagy through its organosulfur components. Phytochemicals are shown to affect cancer initiation, proliferation, and progression. With garlic being a phytochemical, it induces cancer cell growth and reduces inflammatory responses. Garlic contains allicin, which is the main sulfur with active neutrons that produce a large number of allyl sulfur compounds that have anti-cancer properties. There have also been other sightings of this historic fight. The first sighting is the effects of fresh yellow onion consumption. The goal of this study is to observe the effects of consuming fresh onion on breast cancer patients who are being treated with conventional doxorubicin chemotherapy. It is a double-blind, randomized, controlled clinical trial. During the study, a group of breast cancer patients were divided into three groups: those who received vitamin E and flaxseed supplements, those implementing raw onion into the diet, and a placebo group. During a set period of time before the trial, the patients were asked to refrain or have a low consumption of alliums and vitamin E and flaxseed. During the trial, those set groups were given their designated diet and monitored over a period of time, all while receiving the chemotherapy. Through this study, it was found that eating raw onion lowered some markers for cancer in blood. Eating onions while doing chemotherapy might help with treatment for breast cancer. The second citing is aged garlic extract prevents the decline of NK cell number and activity in patients with advanced cancer. The goal of the study is to identify the effects of aged garlic on immune system function and quality of life in patients with advanced cancers like pancreatic, colorectal, and liver cancer. This is a randomized double-blind trial. The study included patients 20 years or older with advanced liver, pancreatic, colorectal cancer were randomly divided into groups, one receiving the aged garlic and a control. Blood was sampled before the trial. Over the course of 12 weeks, patients were given their designated capsule and were instructed to keep diaries. After the trial, they were questioned and their blood was drawn. After this trial, the patients were treated for their cancers ordinarily and not given any supplements, and were also advised not to take any supplements containing garlic. The study found that the aged garlic increased the number of NK cells in the blood, therefore increasing immunity function, but not the effect of quality of life. The final finding is garlic-derived SCVs inhibit cancer proliferation and induce capsaicin-mediated apoptosis. The central goal of this study was to observe the effect of garlic SCVs on tumor cells. To be more specific, to see evidence of cell death and/or the decrease or stunt of cell growth in cancer cells. It is a controlled experimental laboratory study. In this study, human kidney, lung carcinoma, and normal skin cell lines were obtained and cultured. First, garlic was blended into juice, then centrifuged, and SCVs were then isolated. Those cells were then treated with the isolated SCVs, some with different dosages, and observed and compared to untreated control cells over a certain period of time. As a result, the garlic SCVs increased apoptosis among the human kidney and lung carcinoma and increased over time. In addition, the garlic SCVs caused the normal skin cells to grow more, especially in lower amounts of SCVs. Many have asked, did the pungent posse succeed? Well, yes and no. Alliums, and specifically garlic, contain a number of anti-cancer properties that can aid in cancer cell death. There are also numerous studies that suggest that alliums can induce cell death as well. Can it replace chemotherapy? Not just yet. Alliums can be added to the diet in a number of different ways in order to get all the powers and properties that we would want in our bodies. More research has to be done to make alliums a sole cure for cancers, but implementing the pungent posse in our daily diets can aid in the prevention and fight against cancer.